Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Welcome back to the Functional Code podcast. We've got Dr. Jace and Dr. Addy here, hosts for today. Today we're going to go into longevity. We're going to dive into more specifics on the genome. We're going to get into how certain cells function, cold exposure, fasting, exercise, and we're going to bring tools to you so you can utilize those throughout your everyday life. But Doc, we're going to dive into some of the looking from a broad scope first.
Yeah.
And this is something that's going to involve everyone on the whole earth, all humans. Some have already had an advantage compared to others, but I know between the difference of lifespan and health span, a lot of people, I feel, are too interested in pay too much attention to the number instead of the quality of life. So let's just dive right in. Lifespan, health span, differences.
Yeah,
what's your point of view?
For sure. So most people, when they hear the word longevity, which I think is a trendy word, right? They want that because, one, they think it would be important to live a long and healthy life, which I think everyone, I would hope, would want. But they get focused too much on how long should I live versus maybe the quality at which I need to sustain to get to that point in time. So what we focus on when it comes to those terms is, number one, we have lifespan. And lifespan is just the number of years that you've lived in your life. And then you have what's called health span. And health span is, if lifespan is the number of years, health span, we could measure it as of how much quality of life that you've had over those years. So when you think of longevity is just the function of those two combined. It's the quality of life mixed in with how long you've lived. And so when you hear longevity, not only should you be focusing on how long you want to live, but how much quality you can gain out of this life, because I think that's what's most important. I know it would be cool to live to 120 years old, but from age 80 to 120, if that life was miserable, was that 40 extra years of life even worth it, right? So that's where I think it's where you need to have the mindset of, if I want to live a long life, I should start focusing on the quality of what I'm living right now, because there's a very good chance that if you focus on the quality of life right now, you're going to live longer.
Yes.
It's plain and simple. So that's kind of a breakdown of what longevity is, and then how we would measure the difference between lifespan and health span.
Absolutely. And I know Pierre Tia talked about this too.
Yeah.
Like, he looked at the last 10 years of a person's life. How do you want those to be? What activities do you want to have? What relationships do you want to have? And how can you live the fullest all the way up until it's your time? So I absolutely love that point of view. I think taking a step back from the numbers and just looking at the quality is way more important.
For sure.
Now, in terms of diving into some of the specifics and how you can get longevity for a long term of your life, that's where there's a few hallmarks of aging. Now, I'll kind of list a few of these, and we're going to dive into a few of those a little bit more in depth. So we have the genetic instability. So we're going to dive into some of the DNA and different genetic coding that is involved with this. The telomere attrition, epigenetic alterations, loss of proteostasis, deregulation of nutrient sensing, mitochondrial dysfunction, cellular senescence, stem cell exhaustion, altered intercellular communication, chronic inflammation, and dysbiosis. A lot of these are big terms, big words. You may not have an idea, but we're going to dive into these so you have a good idea from a broad scope on how we age and what are the factors that are involved with that. So moving into the DNA. Now, a lot of people say things are genetic, but let's dive into understanding digital versus analog and analogies with that involved.
When you talk about the genome, think of that as the hardware. So you have a computer, right? You have your hardware and you have your software. The hardware is the genome. This is what is already put down in code into your DNA. You have A, T, C, G. These are all these little codes that you can pick apart and take into all DNA strands. And these are already put down for you, irrechangeable. You cannot get anything different. And so when it comes to that, you have the genome. When it comes to the software version of your computer, that's the epigenome. And that's another word that a lot of people are hearing out there, which is like epigenetics, epigenetic influences, markers. And that's where you're going to see more conversation, because you can actually influence epigenetic production or epigenetic influence. So what's the biggest thing that I think people can take away is when you have a gene and it's either going to do something or it's not, that's going to be the epigenetic influence that it has on it. So you have an environmental stressor, the epigenome is going to tell this cell to either replicate one way or another or not. And so that's where a lot of people are talking about epigenetics, because they are starting to see that you have the ability to influence that when it comes to replication and gene expression.
With just even influencing the genome, is there a tool that we use, and is it available to like the whole market itself?
Yeah, so there's right now gene editing, gene engineering tools that are in process. A lot of it is outside of the United States. CRISPR was the first ever gene recognition tool to kind of get put in place. And a lot of people are using that similar software to try and figure out ways to influence our epigenetic markers. I don't think we have a lot of maybe direct to market things that we can see being able to purchase or use. But what is going to come down within the next 5 to 10 years is you're going to see a lot of people start being given cells as a form of treatment or medication. So you'll have these diseases where we are able to read in code the ways that we can impact them through epigenetic influence. So you can maybe take a cancer cell and you can measure it in a petri dish a certain way on how it's either reacting to a certain environment or not. We are also taking other types of cells in our body, exosome stem cells, things like that, to try to combat what this cancer cell is doing. And then what we're going to be doing is seeing the expression that those cells make on this cancer cell, and then taking those cells after they've expressed that certain way, putting it back into the body so that it can again fight the cancer cell.
That's so cool.
So what they're going to you'll find is over time, cells or genetically altered cells will be a way for people to be treated and or helped when it comes to conditions or diseases in the future.
That's unreal.
Right.
Like just of how far science has come, and I'm sure there's stuff out there that we don't even know, that's not even at the market,
right,
that they're testing. I hear every now and then that is it applicable for people to take their blood and store it, or in like storage banks?
Absolutely.
And is that the same thing that we're kind of talking about?
For sure. And I know it was quite popular, I think, within the last 5 years, where people were taking their newborn infants' stem cells and storing them just so that if need be, they would have an access to that kind of product for their infant, or whatever abouts would come needing that product. You know, there are some things that can be helped with that stem cell storage. So, for example, one of the more common ways that stem cells were used in treating conditions early on was using bone marrow stem cells for patients with leukemia.
Oh, wow.
And so with patients with leukemia, you already have an infection in your bone marrow, and so they would radiate you so that it would kill off your entire bone marrow supply, and then they would take a donor bone marrow and they would inject it, and that would basically reconstitute it and proliferate. So that was one of the first reasons that they looked into cellular therapy and gene editing, those kinds of things. So, but now what you're seeing is on the forefront of a lot of regenerative medicine clinics and institutes that are doing research is how can we take cells and almost in a way see how they react to certain bad cells, and then can we take that from a petri dish or a lab setting and put that back into the body. And they're using this for MS, Alzheimer's, Parkinson's, all the other diseases that we know are very difficult to treat. And I think down the line you're going to see cells as a very common form of therapy once they can dial this in appropriately, because of course with anything you always worry about safety and efficacy versus any type of treatment. So you want to make sure that those cells you're putting back into the body aren't going to go and replicate into something worse or do something that's damaging to the body.
That is unreal. And there's so much to it. I feel like you have to look into multiple points of view. What are the stresses involved? What are the life factors involved? And the aging of the cells, or the difference of how they change over time, thus go into either cancerous cells, dying cells and whatnot. So even just based on the DNA, the analog versus digital, in terms of the unspooling of the genome and how that can be influenced over time. What other factors are involved, whether that's environmental factors, and what genes can be influenced with that?
Yeah. So I think a good analogy for people is we'll stick to computers since that's what we're talking about. You have your hardware, you have your software. You insert a CD disk, we'll call that your DNA, into the computer. And you have all of that information stored on your CD. Now the problem over time is that CD might become scratched, and it might become harder for your computer to read. And so that is where the epigenetic portion of things comes to play. So when you have this stored information on a CD, it doesn't mean that it isn't available for you to access it. But if you can't read it, then there's going to be misinformation, basically. So over time, what we know is our hardware, or the DNA strands and all the information that it contains over time, it doesn't become damaged or ruined. It's just the way that the epigenome reads it can over time become affected. So as we age, that starts to get impacted. And what that means is the epigenome, which tells cells how to replicate, may be impacted. So for example, the epigenome tells a kidney cell that you need to continue replicating as a kidney cell. It tells a liver cell you need to continue replicating as a liver cell. But what will happen is over time there might be a miscommunication because of just as we age, our cells lose that ability to maybe properly communicate, like we talked about with hallmarks of aging. And what we find is all of a sudden something is growing or replicating that it shouldn't be, and we have cancer. Or we aren't replicating and we've lost that ability, and now we have lack of something, which could be a lot of things. It could be muscle, it could be some type of brain's tissue. So that's where I think a lot of people, when we age, that's truly what is happening as a whole, and why so many diseases, conditions pop up, because those are just things that are going to be inevitable. And so when it comes to aging, like we had talked about the 10 or 12 hallmarks of aging, a lot of the hallmarks of aging that have been studied all impact either a disease and or condition in the body. It's it's definitely the fundamentals of those kinds of things. So the main importance is making sure that we don't misunderstand what the body is doing in order to try and help someone. So it doesn't mean that we can't try to stop that from happening, or at least delay it. There is yet to be any type of study or research out there that can actually stop aging. And there's no drug out there that can do it. And I know a lot of people, when they're looking at longevity research or trying to look at longevity supplements or even Googling anything having to do with longevity, I just want you to know that we cannot stop ourselves from aging, but there is certain things people are trying to do out there to at least reverse it temporarily or prevent it from accelerating down the road.
Absolutely. And that's where the quality comes in.
Yeah.
When you brought up the change of the genome and how it can influence the unwiring, unspooling of the DNA and the miscommunication it has over time, and then it re-replicates as well, is that where the nervous system and how it goes from the brain out to whatever organ, if that communication starts to die off, does that also have an impact, or is it more on like a cellular level?
I think it's both, right? Because what will happen is with any cell, communication is utmost important to making changes in the body. So when we have lack of communication, we're going to see changes in the body. One good way for you to understand that is when there is compression on a nerve. For those of you, I'm sure you've felt this at one point or another. You have either fallen asleep, or maybe some of you have dealt with sciatica or neuropathy. There is either compression or damage to that nerve. And what you find is that breakdown in signal creates an effect, and that's tingling, numbness, burning, some type of symptom. And that's due to a lack of communication. The brain is trying to send a signal through that entire nerve, the axon. And what you'll find is because there was either a breakdown in communication along that entire pathway, it's going to have an effect of a symptom. So yeah, when it comes to not only a nerve, but an organ, it's the same issue. The brain is going to keep sending signals, and the organ can only do so much if there is a breakdown with either the amount of cells, how the cells are working, what they're doing. And that's really where, as we age too, those kinds of things are bound to happen. So the question of what to do comes on more of, it is cellular. And I know when you're breaking down things into cellular levels, it can get boring. But what most people already are doing is impacting their cells. It's just the foundation and the knowledge of it is important when you're going to talk about longevity, because a lot of people who want to do this, they need to understand that they're already going up against a current of water. If you're, let's call it a boat analogy. So no matter what, you're already traveling upriver. I mean, you are. Right now, as you and I are sitting, our discs are very, very slowly losing their space. And that is something that we cannot stop. Our cells are either helping, or some have already stopped what they're doing and they're now dead zombie cells. And our bodies are hopefully going to either get rid of them or they won't. And over time, our job is to try to clear those old cells out as best as possible so that we can then reintroduce healthier cells for us to continue to age appropriately and have the kind of quality of life that we want. And so we're going to dive into that, obviously, as we get into the podcast today on ways which we can. There are definitely ways to impact that, improve those kinds of things. It's just a matter of what can we do and what can't we do, right?
Yeah, and even diving into like the comment you made on how the nervous system attaches and goes to the organs. On top of what Dr. Addy was saying is, what are things that you can actually do? What are the tools that make sense for this line of communication? And that comes either via diet, either decreasing stressors. Some of these things we're going to dive into a little bit more, but another huge aspect is making sure that the nerves from the brain, spinal cord out have proper lines of communication. And I think that's also where we come together as chiropractors, saying that from our point of view, if we're not having proper neural flow to any organ or any tissue, it's going to affect how that tissue functions, not only on a day-by-day basis, but also over time. If the nerve starts pinching off on a garden hose for long enough, the cells that are replicating over and over again are going to keep replicating, misinformed, but there's certain things that we still don't know, just even on that level over a long period of time, that I think definitely needs more research involved with that. But I absolutely love your input, on that one. Now, in terms of the longevity genes, there's certain things I know we can look at from a nutrition standpoint, supplementation standpoint, but just even, Doc, to dive into the longevity genes. I've read into this a little bit myself. It's been a bit. How does that impact with everything else?
Yeah, so sirtuins are, when we talk about genes, like we were talking about, there are certain genes that they've been able to correlate longevity in human life possible. So when it comes to the certain genes, one of them that's most commonly heard about is called a sirtuin. And the reason why it's popular is because it has a lot of ties to other types of molecules and processes in the body. And you'll even start to hear, as we talk about sirtuins, some other maybe trendy longevity terms pop up too, because they're definitely involved. So sirtuins, think of them as just regulators of the epigenome, and that's what they do. So they're involved in regulating the epigenome. One thing that they are tied to, I guess, is what's called NAD. So when it comes to NAD, NAD is required for sirtuins to function. So which brings up the idea of, if we have more NAD, we have a better ability for sirtuin to work, which allows then the ability for epigenetic regulation to occur more effectively. So when it comes to aging, right, over time, just like with a lot of things in our body, we lose more and more NAD as we age, which then in turn means the sirtuin isn't as effective as it could be. So that's a lot of the reasons to why NAD is pushed so much as a longevity option, because NAD, again, can improve sirtuin, which again improves epigenetic regulation. The ties that sirtuin has to other parts of the body is vast, and there's a lot of research on it. I'm not going to go too much into it, but it can definitely affect the inflammatory components of the body. It can affect replication. So that's basically sirtuins and how NAD is involved with that process.
Okay. And even with like NAD, I hear, and I've tried some of the supplements myself. I feel like I've tried 3 different kinds. The one kind that I've noticed a difference with, for me, it was noticing more energy. It was noticing more like mental clarity, less brain fog. Was one that came in the refrigerator, or you want to keep it cold. I don't know if that's due to the properties within it. I'm not 100% sure, but I know I definitely felt a difference for that one compared to the other ones. I stopped taking it in recent, but the one thing I haven't tried is the one via IV. So have you tried any of these yourself? Have you used them with patients?
Yeah, absolutely. So with NAD, there is, just like we would take a precursor to something or the actual supplement itself. So a lot of people maybe understand this analogy. We have CoQ10 and we have ubiquinol. And so ubiquinol is the broken down version of CoQ10. So some patients over certain research and studies have responded better to taking the precursor to something versus actually taking the supplement itself. So same thing with NAD. NMR, or nicotinamide riboside, is basically the precursor to that. And so what you'll find is patients will take the precursor and they'll see effects just as though if they were taking NAD. Now you can take the precursor in an oral supplement form. A lot of patients respond with improving, saying that their energy has improved. Like you said, clarity, focus, those kinds of things is definitely what a lot of patients that have taken it have told me. Well, I have yet to take the precursor, but I have done the IV NAD infusions, which is again just NAD in a liquid format that's injected intravenously. And again, you'll find it's quite an impact to the body when you're having it done. It's some people who will get nauseous, they'll get maybe flushing. It's kind of a reaction the body has when it's injected intravenously. But what you'll notice is, again, what I found was increase in clarity, mood boost, energy boost, those kinds of things too, which just overall function of the body has improved, and those kinds of things were with the effects that popped out. So
that makes sense then.
yeah,
That's so cool.
yeah,
And yeah, I think some of this, as more research comes out, it's going to be more covered, hopefully, by insurance and put more mainstream into the public eye, because I think there's certain things that we know thus far can impact how one can live a long, healthy life. Taking a different step from the epigenome, but looking at it from a different point of view via proteins, and how the proteins can impact the body, not only breaking down the muscle, and we all know if you don't have enough muscle long term, it's going to lead to risk of falling for some people in the older age, which if you look at those studies, if you break a hip at age 65 and older, your risk of mortality increases significantly for like the couple years afterwards. So looking at how we can keep the proteins and how the body can function, I know that'll come via mTOR or TOR itself, that we've noticed that in males. Doc, I would love your expertise on mTOR and how that influences not only longevity, but also the muscles and tissues of the body.
Yeah. So with mTOR, again, is this, we'll call it component in a lot of animal bodies. mTOR is just the mammalian form, so that's why it's called mTOR. But mTOR is your master cell growth regulator. And so it's just making sure that cells are growing and repairing how they need to. One specific thing that it can do specifically for protein is it senses the amount of amino acids in the body. And that's important because in order to create protein, you need amino acids. And again, there's back to amino acids and protein, right? Precursors. A lot of patients, we covered this on, I think it was our last podcast. You know, those who take amino acids or those who take protein, both are effective, some more than others. So that's really where mTOR again is being studied as the longevity gene, is because if you can improve your ability to have proper proteostasis, which is what we talked about as a hallmark of aging, when you have the decreased ability of proteostasis. And proteostasis just means your ability to have proper protein synthesis and repair. So why that's important is because protein plays a crucial role in muscle mass formation. And we have talked about that before. We look to longevity, muscle being a crazy, crazy marker of longevity. Making sure you have strength and muscle mass going into the later years of your life is a huge, huge measurement of longevity. So again, that's where mTOR is being looked at as another longevity gene because of its crucial impact on the ability to sustain protein regulation and growth. So,
oh wow,
yeah,
that makes way more sense because I hear this word mTOR so often,
Yeah.
and just to see how it is influencing not only how the body functions but also the longevity aspect, I think that's it makes a lot of sense on why we're bringing it up today.
And Dr. Peter Attia is another gentleman. David Sinclair too is a lot of the two guys we've kind of used a lot of their work to talk about in the podcast today. But Peter Attia talks a lot about this with just how crucial muscle mass is as a measurement of longevity. He says that number one, VO2 max is probably the biggest measurement of longevity, and then right underneath that, or even he said aside of that, is muscle mass and strength for sure. So
that makes a lot of sense too. And even going back to my point on risk of falls, but just how people can function over time,
right,
especially in the last 10 years of their life.
Yeah.
It goes back to quality of function more so than the number. Again, you're going to hear us say this quite often over and over, but it matters.
It does.
Okay, so now we know the DNA aspect and the unraveling of the spools, which can affect the cell function, how proteins are playing at tissue, muscle growth, and how that can be regulated over time. I hear the word senescence a lot, and how over time certain cells break down, and I think you revert to that as like the zombie cells.
Exactly.
How does that play into this
Right.
equation?
Good point. Cellular senescence. Senescence really is just these cells that have become, they have no more input into the body. So they've either stopped replicating or stopped doing their job. And they're now taking up space. And they still require input signals to try to get these cells to do certain things. And so what a lot of the times happens is when these cells die, and they're just wasted products basically, they can still put out panic signals that they're dead. And that can lead to inflammation over time. And we know inflammation, huge driver of disease, huge driver of a lot of conditions, especially pain. So with these senescent cells, we want to make sure that we can figure out a way to kill them off. And your body can do a good job of that by itself when it's healthy. But as we get older, again, we have more senescent cells, we have more aging. One of the ways that a lot of people already probably practice this without even knowing is trying to induce autophagy. And autophagy is just the cellular turnover of dead cells. And that is done by fasting. And so fasting, again, why that's such a huge longevity trendy term that's coming up is because it induces autophagy, and autophagy kills off your senescent cells. So again, when we look to fast, we are not only looking for a lot of the benefits, and we'll get into the benefits of fasting obviously in the end of the podcast, but one of the major reasons that it's so crucial for aging and for longevity is because it kills off your dead senescent cells.
That makes a lot of sense too. And then, shoot, I suppose let's just dive right into fasting since we're on it. And in terms of how we can break down and just even how we digest food, a lot of that is if food comes in our body, we have to break that down to utilize all of those resources for energy, for waste products, just so we can function throughout the day. Some things that come in are better for us than others. Some things that come in not only on how we inhale, but also from the environmental factors, that all has an effect on how our body functions on a daily basis. In terms of how fasting gets put into this equation, anytime we have a break, especially our digestion, it allows for repair of not only the organs, but also for the gut microbiome. And that's why for most people, doing a round of fasting for maybe not every day, maybe not every week if it's not for you, but trying it maybe once a quarter, maybe one day a month, so you can kind of renew your body. And I know this is put into other religions, which makes sense on why it's lasted the test of time. It makes sense for our body. The effects of fasting, there's a whole array. Doc, if you want to go into any more of those, I mean, by all means.
For sure. So some of the main improvements that a lot of people will notice right away with fasting is you're going to have a loss of weight. And so for sure, obviously if you decrease calories, you're going to lose weight. But that's more of I would call it more of a side effect of fasting, because not to say you shouldn't have an appropriate weight, especially when it comes to obesity and just all the things that obesity can drive as far as comorbidities and disease. But what we primarily see with fasting is your decrease in insulin resistance. So for those of you who, I'm sure you've heard insulin before, you're in health class in high school. So what happens when you eat food is there is an uptick of insulin to help drive sugar from the blood into cells. And why that's important is because you don't want sugar to stay in your blood, because then you get a high blood sugar. Those who have a high blood sugar have diabetes, and we know that. So what's crucial, and actually what's crazy, is your body does an amazing job of titrating your sugar. And it's been known that you have about 1 teaspoon of sugar in a healthy adult circulating your blood at all times, about 1 teaspoon. And this is, Peter Attia talks a lot about this too, but what's crazy is those who are either diabetic or have altered blood sugar, they only have about 2 teaspoons of blood sugar circulating in their body. So we only have a difference between 1 teaspoon of sugar from going from healthy individual to morbid obese and diabetic, and to the point of like death. If your blood sugar gets to half a teaspoon, you will die.
Oh my goodness.
Yes.
That is the impact.
And so what is behind all this is your liver. Your liver is titrating constantly about, I think it's a teaspoon every 3 minutes.
Oh my
It's
gosh,
titrating
okay.
it off to make sure that you have about 1 teaspoon of blood or sugar regulated in your blood the entire time.
Absolutely.
So that's where insulin plays a huge role, because it's the driver of making sure there's not too much sugar in the blood. So what happens over time is if you continue to eat, you'll continue to secrete more insulin. But over time, what will happen is your receptors of the cells that are trying to drive sugar away from the blood into the cells become dampened, because so much insulin is being produced. Two things are happening. One, the cells are dampened. Two, you just lose the ability for insulin to impact these cells over time.
Okay.
So what that means, right? When you break this down, your sugar in your blood is staying in your blood longer because it's taking more insulin and more time for that signal to communicate. Like we talked about breakdown in cellular communication. And over time, that sugar will continue to then accumulate. And over time, it will take more and more insulin for you to secrete to get the job done. And over time, that will eventually just cut off or be very, very difficult for that signal to be relayed if you continue to eat way too many calories, especially, on ultra-processed carbs and those that have a higher uptick in insulin. So we talk about the glycemic index. Glycemic index is how much insulin spike happens after you consume food. So the difference between eating a protein versus eating a carb is different. When you eat a carb, the glycemic index is usually higher, so that means the insulin spike is much higher. Versus eating protein, the insulin spike is a lot lower. So these are a lot of the reasons why you're seeing people purchasing glucose monitors and starting to track just what that insulin spike looks like, and making sure that over time you just monitor the amount of spikes that you have. Because there was a really great doctor that I learned from, who was a functional medicine doctor, who said the more insulin you secrete at a higher rate, the quicker you die, is how he put it.
Yeah.
Because over time you need that process to be fluid as long as possible. Because of course, with a higher amount of blood sugar becomes to diabetes, and with diabetes, of course, you're going to have weight gain. You're going to have a breakdown in the ability to regulate your nerves. Nerves can die. Nerves can get impacted. When nerves die, obviously that has a crucial impact on your organs and other functions in your body too. So, especially your heart.
Oh gosh.
So what you'll find too with obesity, it increases high blood pressure. And that, of course, that's what I mean by impacting your heart too. So overall, wrap that up. Insulin, it's very important to make sure that you have what's called a better insulin sensitivity, not resistance. You don't want any resistance for communication of insulin to the cell. You want it to be as sensitive as possible, so that your body does not have to secrete as much. It can clear the sugar out of the blood as quickly as possible, store it into either the muscles or put it into the cells.
I do want to go back to the point you made in terms of glucose monitors. When looking at it from a practitioner standpoint, not only do you not have to have diabetes to have one, I think most people, especially age of 40 and up, to monitor their glucose at least for maybe 1/4 of the year, so you can see how you regulate certain foods, I think is also incredibly important.
Yeah.
You can even look in terms of like either go to YouTube videos and see how to work the glucose monitor, try it on yourself on a day-to-day basis for a week long. You're going to notice certain foods that you might react quite a bit more, thus insulin spikes, and other foods maybe not as much. And then pay attention also to how you feel, how you function. Is there other stressors going on in your life, and are you able to combat those stressors even better and have more information coming to play? I've used that with one other patient in the past, and it actually worked out really, really well, but I definitely would suggest that for others, individuals moving forward. The kicker with that is, for most people, they don't want to spend their money on it, especially if it's not covered via insurance.
Yeah.
And practitioners, especially medical doctors, they're not going to often prescribe glucose monitors unless you have a condition, diabetes or whatnot with that.
But what's crazy is if you do happen to monitor your blood glucose, you'll find the patterns quite quickly. And most of the time what you'll find is it's when right after the spike of insulin or glucose happened comes the drop, because what goes up must come down. And what down means for you is low energy. And it's the crash, right? It's the crash we talk about right after consuming coffee, right over, which probably contains sugar, unless you're drinking it black, or sugary breakfast cereal, something to that nature that has a higher glycemic index. So what you'll notice is right after that spike comes down, that's when we crash. That's when we have those energetic spunks. So with patients that are monitoring themselves with that, you might actually see some interesting data when it comes to the blood glucose monitoring, because I want to make sure that if you are having those kinds of conditions or those kinds of effects from either poor diet or just not knowing why you're having those crashes, I bet you that glucose monitor will give you some information pretty quickly. And so, oddly enough, there is people that do this on YouTube all the time, like you had said. Yeah. It's crazy the kinds of foods that they go and research and test that you wouldn't expect to have such an impact on insulin spike. So, crazy for example, was a guy, what's called a lean cuisine. It's those microwavable, it's supposed to help you lose weight, right? Well, what had happened is he ate it and his blood sugar spiked incredibly high. And we don't want that, especially if we're gonna be losing weight. We want to try to have a very stable blood sugar. So just again, be cautious with the things that you hear online and the kinds of diet companies or other types of products that you go to purchase, because and it may all seem fine and good, but there always is a method to their madness. They want you to eat their product. So who's to say that they don't maybe make it a little bit more tasty and enticing so you continue to eat it, right? Something to think about.
A lot of the times businesses look at the business first and then the customer second. Some don't. I don't want to generalize everyone together, but yeah, it's such an important factor. Now, in terms of fasting and how you start this, and Doc and I would definitely agree, before you start fasting, consult with a practitioner that's monitoring your body, because there could be other conditions that might not suit fasting, especially for you. However, going into how to start fasting, I think for most people starting off maybe 4-6 hours at a time, and what meal do you want to give up or push out of the way? And then do you want to do that before bed? Do you want to do that in the morning? That might depend on your lifestyle. It might depend on, are you either a night owl or do you work overnight shift worker? Or are you one that is a morning person and you have most of your impactful minutes and tasks done in the morning? This will depend on what factor or what bucket you land in. When I have people start off fasting wise, like I said, I have people start off either 4 to 6 hours and then see how well they do for probably a couple days. And then from there, we can build up to 12 hours. And then over time, we can then try 24, 48 hours for some individuals.
Yeah.
But Doc, how do you start people on a fasting scheme? And there's certain things that you look for.
Yeah, for sure.
Monitoring.
And good point, because everybody's different. I've had some try the certain ways and it just didn't work for them. One of the most common ways that I like to start patients is just skipping breakfast. So eating at about anywhere from 6 to 8 p.m. as your last meal, and then consuming your lunch at 12. That'll give you about that 12 to 16 hour fast, right? Which is kind of where you want to get to when it comes to the regulating effects of fasting over time. So it's that 12 to 16 hour range that gives you a lot of the things that we talked about when it comes to the benefits of fasting. So over time, if you continue to do that every day, those 16-hour fasts or 12 to 16-hour fasts over time is where you're going to see a lot of improvement in the insulin sensitivity like we talked about. It is where you'll start to even get into a better metabolic rate. You'll maybe even have weight loss with it, depending on what you eat in the other 12 to 8 hours. So yeah, we want to make sure that, of course, if you're going to do this, you're going to do it appropriately. If you feel that breakfast is just something that you can't go without, then you might want to look to a 12 and 12 fast, where 12 hours a day you're fasting, 12 hours a day you can consume in a window. That's usually a pretty good start for most. A lot of the times when you start to fast and you enjoy it enough, you can push yourself into maybe a 24-hour fast where you just don't eat for 24 hours, you just do strictly water. There are things that can impact whether you stay in a fasting state or not too. So for those who maybe are familiar with the ketogenic diet, one of the big pushes with the ketogenic diet was, and this was Dave Asprey who kind of started just talking about the ketogenic diet, and he was the one that kind of pioneered the blazing of the trail of it. He took a low-carb diet and paired it with intermittent fasting in his protocols, and he talks about ketosis. That's what ketogenic diet is. So when you restrict carbs and you fast, you will get into what's called a ketogenic state, which means instead of you burning glucose, your body will then turn your fat cells into ketones. And that can be then, your body can then go off of ketones as an energy source. Two things with that. One, a lot of people feel really good in a ketogenic state, and two, you're burning fat. So it's kind of a win-win. However, it's really difficult to get into a ketogenic state if you've never done it. So that's where, the caution is there. It takes anywhere from 24 to 72 hours in an adult to get into a ketogenic state. I know that I've had patients get into a ketogenic state even under 24 hours, but they're pretty healthy, and they definitely, exercised good caution doing it. But the goal for sure is to do this more than just once, right? So not to say that you can practice this maybe a few times a year, but if you're going to do it a few times a year, then I would recommend you maybe do a longer fast to kind of give you that push. So with being in a ketogenic state comes also autophagy, which was that word that we talked about, right? So, and I know that there are some differences in research when it comes to this, but autophagy doesn't usually happen until about 3 days of fasting. So that really big push of senescent cells being killed off and replicated, that is where you're going to want to get into that larger fasting state to get to that benefit. There was a Harvard scientist that I think came out not too long ago with a pretty viral video that a lot of people are kind of controversial talking about, but he said that a 7-day water fast at least once in your life after the age of 45 will limit or reduce your chance of getting cancer by 70%. In
7 days.
7 days.
Wow.
Yeah. And to say, I don't even know how many people have ever done a 7-day fast. I have not. But I can assure you, I've done 2 to 3 day fasts, and 7 days it would be incredibly difficult. But it's exactly what we've been talking about during this entire podcast. When you fast for that long, those cells are killed, and you then can introduce brand new cells that are healthier and actually contribute to the body. So yeah, take that as I would say you don't need to start with the 7-day fast, but for those of you who are interested, fasting is one of the most well-researched topics when it comes to improving your life, not only your lifespan, but your health span too.
Yes.
So
how was your experience with fasting? Because actually, yeah, you go first, because, well, my experience, and then I kind of want to know your feedback on that.
So for me, I've always been able to fast. I've been intermittent fasting now for close to a decade.
Oh, wow.
So I don't usually eat breakfast. The only time that I switched that up is when I was putting on some weight and I bulked. But before that, I had intermittent fasted for about 8 years. The way that I did it was I would consume my last meal no later than 8 p.m. and then my first meal would come around 12 to 1. So that would be about 16 hours. And when I first started intermittent fasting, I noticed right away, because again, I'm a male, so we lose weight a little easier than females. But I did lose weight quite quickly by about like 30 pounds. So I lost 30 pounds in like 3 to 6 months, I think, somewhere in there. So that was huge. I did notice too, just all around, I was able to perform when it came to academia, sport, workouts, just being more cognizant. I had clarity. I felt better. My mood changed. I mean, you name it, man. I had a lot of the positive things that came across it. And I noticed too that when I eat, especially in the mornings, I'm very sensitive to certain foods, especially with my blood sugar. So the carbs, especially for me, when I eat carbs in the morning, I do get that dip really quick. And I make sure that if I do want to eat in the morning, then I eat protein only. Because again, when it comes to spiking of your blood sugar and kind of how it dies down, you have carbs, which is a quicker rise, quicker fall. And then you have protein, which is not as high and a longer delayed fall. And then you have fats, which is this very low and very delayed energy source, but it very rarely has any impact on your blood glucose. And so a lot of people, the ketogenic diet being one of them, love healthy fats as a big portion of the diet because, again, it's a sustainable source of energy. And you need to eat a lot of fats if you're going to be in a ketogenic state, because that's where you're getting energy right now. So
That's crazy.
But yeah, so with me, I have continued to fast. I love fasting. The longest I've ever fasted was 3 days, and that was very difficult. I'd lost weight with it, which I'm a lean human, and I've always tried to keep as much weight as I can. So I've chosen not to do that kind of fast anymore unless I get to a certain weight where I'm comfortable to lose a little bit. But again, that's also something that Peter Tia talks about, and we talked about this before the podcast, where fasting, again, huge proven benefits to increase longevity and life and health span. But again, if you're going to lose a lot of muscle mass with it, then there may be something to think about there before you get into that topic of fasting. But yeah, so with you, what did you see, and what were the kind of effects that you felt?
So for me, and I've dove into this off and on throughout my life. I started this when I was in college, undergrad, starting with intermittent fasting, not eating breakfast exactly kind of how you recommend people start. Noticed the effects in terms of clarity, especially at school. It definitely helped out so much.
Yeah.
And as I got more experience, and I did that off and on, depending on, kind of like you said, for certain times of the year, I need to put on weight, maintain muscle growth, and also function. But once I reached like a 24-hour mark, I started getting like, I feel like I want to throw up, and sometimes I do to a certain extent, and I just can't go past that. A few months back, I made it, it was close, almost to 48 hours, somewhere around 44, give or take. Almost broke through that barrier and then felt great. The energy was there. I definitely lost, it was probably 8 pounds or so. So I definitely felt the effects, and it's a part to where my body's never been through, which I felt great. But getting through that part and not understanding why I feel like I got to throw up, and sometimes I do. I guess, do you know why that is? Or
It's interesting. I'm sure nausea comes from a few things. One would being just not having enough sustenance, and you're an active individual, so you're kind of burning at both ends, and you just don't have the sustenance to keep up. Maybe that's just something that happens. But yeah, I do think that I've heard that, and I think for sure patients have reported nausea. Not as commonly, but it is there. I think what it is too is it could just be a signal that your body is sending out too, where it's just like, I need something. You're going too much for me, and I need something. Otherwise, it's kind of your body pushing back of whatever you're doing right now, because it maybe hasn't done it. And so if it's worried, and it's like, hey, your brain is a survival organ. And so if you're not getting calories, it's going to be panicking, and nausea might be the signal that it sends out.
Must have been.
Yeah.
No, thank you for that. I've tried going multiple days until I did that one. It was so hard.
Yeah.
Got so frustrated with that.
What's interesting too is when it comes to calories versus the differences, of course, with proteins and fats and carbs, and we were talking about the ketogenic diet. You'll find this too with fasting, especially if if you have a significant other who's opposite gender of you, you're going to notice that they may not be as, especially for a male comparison to a female. Females are very, very different when it comes to fasting and losing weight and all those other kinds of processes, especially if they're not eating enough carbs. Yeah. So what I have found too is if you're a woman who's trying to fast or doing a type of diet with lower carbs, where you're restricting, it's even worse. And you might even have worsening effects because, again, the genetic makeup that you were given as far as programming was to store and to retain so that you can, of course, give birth to a child one day, whether you do that or not. But that is the evolution of a woman. And so when you go into that panic state of not consuming calories, it's even worse for a woman. And I do notice that women have a tougher time fasting than men. Women don't obviously lose weight as quickly as men either. And those who especially are still menstruating, carbs are a crucial role in regulating the menstrual cycle. So for those of you, maybe this isn't everyone, but those of you that have done a ketogenic diet, you know that it's very difficult right away to get into ketosis. So over time, what you might end up doing, and Dave has kind of redesigned his entire program because of this, because he noticed it too, he was getting a lot of feedback, was doing what's called carb cycling, where once a week for a day you eat a bunch of carbs to kind of do a refeed. And that actually gives a lot of women a huge positive benefit when doing a kind of diet like that, because again, it is crucial for the cycle and just management of hormones, those kinds of things. So just again, something to think about if you are a woman and trying to do those kinds of things. But what I do know is the woman that I had do the fast, it was actually my girlfriend. She did a fast and she was in ketosis by 22 hours.
Oh, wow.
Yes, she was in ketosis by 22 hours. And like I said, it takes about 24 to 72 depending on yourself. But we were able to track that with what are called keto sticks, where you just urinate on the stick and it'll pick up if you're in ketosis or not.
So cool.
So again, there are many things that can break ketosis too. Maybe we're kind of getting into the deep end of that right now, but
Beautiful.
I'll finish it up with making sure that if you are going to fast, to strive to autophagy and to make sure that you want to hit those benefits, you don't consume anything that will pull you out of ketosis, to pull you out of that fat burning stage. And that is going to be usually sugar, primarily. There's some research to show that protein actually isn't affecting autophagy now that they're doing more studies. It might affect other things, but I don't think it would affect ketosis and or autophagy. So just something to think about as you continue to do that. But definitely do your research, and I wouldn't dive into the larger fasts without practicing the shorter fast first.
And then going back to your point that you stated the carb load and then a couple days off, even from like the evolutionary standpoint of when we were hunters and gatherers hundreds of thousands of years ago and how we evolved. Some people went days without finding a meal, but when they got the meal, and that's also why when people gather in a community setting, there's hormones that go off, neurotransmitters, which make people feel good in a community.
Yeah.
But also from finding the food that we get and the resources we have, and that's why people utilize every single part of their catch of whatever, usually mammals. Back in the day, it was either mammoths, whatever they could find, whatever they could hunt, and then they tried to preserve that for a period of time. And how we can go back to how our DNA and genes have been evolved. And that's why I think most people should try this. But then again, if you have other conditions, you have to be safe with this. Like, our bodies are made to hunt, scavenge, come together as one so we can evolve over time. And this is kind of where we're at thus far. Unfortunately, with society making everything easy to get food, we're not going into those barriers of breaking down or autophagy, like you're saying. So looking at it from that point of view, to see if we can go back to our ancestral ways, for at least not consistently, maybe for some people, but maybe a couple weeks of the year or throughout the year, I think is incredibly valuable.
For sure. And so kind of like what we were talking about when it came to improving our muscle mass and making sure we stay on top of that portion of things because of the longevity and benefits. I think the question is, one, Doc, obviously, when it comes to movement, I don't think there's anyone better to talk about this subject. We know exercise is so crucial and important. I don't think there's anyone that'll ever argue that. But when it comes to longevity, just how crucial is movement, and why is lack of movement has such a profound effect on the body? And maybe just talk a little bit about that kind of to get started.
Absolutely. No, thank you for bringing that up. In terms of movement, we are evolved to move. We started on pretty much 4 limbs, hands, feet. We evolved also from the trees and hanging. Our torso redeveloped. Certain tissues crossed over different joint barriers, which helps us to scavenge, move, throw objects, but also comes with a disadvantage against gravity, which can break down certain other aspects of the body, lower back being one and also upper back being the other. The transitions between the rib cage is incredibly important, and just even paying attention to what positions our bodies are in. But when you look at the longevity of how someone can move over a period of time, you have to look at from a couple different points of view. First off, the cardiovascular system, which is one of the main runways that help bring nutrients to certain tissues and then also bring the waste products to get filtered out. So if you don't move certain areas of your body over time, it's going to lead to the breakdown of not only the genome, the DNA at that local site, but then also it can lead to other diseases. It can lead to other maladaptation in terms of how you function. So you look at this from people with weight loss. Weight loss is a systemic factor, but it's also localized. So if you're not working certain tissues, the body is not going to break those bonds down to filter out some of the fat cells or adipose tissue. So look at types of cultures, types of people that can last a century long, 100+ years. Look at the practice that they developed, one of which is the monks, and how certain practices that they go into is quite fascinating. For them is meditation, is calming the mind, it is being very aware of your internal body state. And the more aware you are of something, the more neural energy goes. And that can also be consciously, like you can actually think about it, and then also subconsciously. So a few practices they have is meditation. Like I said, the other aspect is movement, focus, like Tai Chi or any type of martial arts is also stemmed from that aspect too. So if you're moving certain parts of your body, you're getting blood flow, you're getting activation, especially if it's controlled. If you're younger in your life, or if you don't want to build up the performance aspect, then you can go into just the movements, the focus. But if you want to build up the movement, then speed gets involved, different angles of movement depending on what your goal is. I looked up who is the oldest living person to date, and it was a person by the name of Jean Calment. She was from France. She lived 122 years, which is unreal. She was born in 1875 and passed away in 1997. And thinking about that, I'm like, how evolution accelerated and the things that she saw.
For sure.
It's going from like buggies to the automobile to the phones to technology. She almost lived to like AI and how that kind of came into the factor. But some of the things that she was stating that helped her live as long as she could was decreasing the amount of stress in her life. So that is the setting of which friends and family, how are they impacting you? But not only that, how is work? How is her purpose? How is that factoring into the equation? The other aspect was some of which good genetics, some of which a positive outlook on life. The more negatives that come in, can break down the body over time. And then she also adopted Mediterranean diet as well, which we can get into to a certain extent as well. But she also did fencing and she did cycling. So when you look at movement, she's spending a great deal of energy on her legs, and it's more of a full body movement, something that you could do later in life. And in terms of fencing, it's almost like sword fighting, if you will. And that then includes the arms, includes the torso, includes reading and proprioception off of one another. And that's something that I kind of want to try fencing myself. But it was just, how well can you adapt the cardiovascular system and the blood flow to the organs, and how that can get reprocessed through on a consistent basis, and to retrain the heart. Because we know now that if you have decent cardio over a longer period of time, the better functioning your organs are, especially brain health. And that is one aspect where it has been recorded to break down and improve Alzheimer's disease. And I know we were talking a couple of days ago on the flushing of the brain. So, Doc, what's your standpoint on exercise and movement?
Yeah.
Even
I think when it comes to exercise, it's such a broad topic. For as far as longevity goes, I'm going to bring it back to the markers of longevity, which was VO2 max and strength and muscle mass. So I loved how you hit on cardiovascular, because that's exactly what VO2 measures. It measures the overall ability of you to output basically cardiovascular performance. So when it comes to cardiovascular strength, I would say the heart is going to be one of the first organs that's going to go when it comes to aging of the body. If you are not keeping that guy ticking, that's going to already put you at a disadvantage to lifespan. So, and probably health span too, obviously. But if we're just talking in terms of how do I stay alive the longest, if you aren't training your heart, think of it this way, you have a finite amount of heartbeats. It's not limitless. Like, eventually it will stop ticking.
Yes.
So what can you do in the amount of ticks to increase the life you have? And cardiovascular health is for sure important. And I'm saying this to myself because I definitely need to do a better job of that too. As far as strength training and muscle mass, which is something I think I put a lot more time and effort into, that's going to be so crucial to improving not only movement, obviously, but movement at a later time in life. Because we know as the body ages, you could possibly develop what's called sarcopenia, which is just wasting of muscle tissue. And of course, with sarcopenia comes fatty atrophy and just a lot of other types of destabilizing components of the body. So when we are not exercising tissue, there is a breakdown in that tissue, and it's replaced with fat, and that causes weakness, and it causes pain, inflammation, those kinds of things. So we know that over time, those are the reasons why they talk so highly of VO2 max and strength and muscle mass, because when you aren't using them or training them, then they get weaker and cause a lot of other issues over time. So, Doc, I know with those who want to get into this, but maybe don't want to train every single day. Is there a minimum when it comes to exercise, or at least getting the appropriate amount of benefits that coming? Let's just go with cardiovascular, number one. What is a minimum that people need to try to hit, and what does that look like as far as movement and exercise?
Absolutely. I feel like all of us want to know what can we do, what are the bare minimums that we can do, but also even go past that, because we have to start at some point and then build up from there. So in terms of the bare minimum, we want, cardiovasculature wise, we want at least 30 minutes a day, a couple days a week. Let's start off with there first. And that could be either a mixture of moving not only the body, but also to get the heart rate up. Depending on age, it'll have a different factor. So when you first start off, for most people, going for a walk for a couple times either throughout the day, and then get on a routine with that. Let's say if you want to improve longevity long term, I've told patients this before, getting a dog and making sure that you walk them 3 times a day. And that'll keep you consistent on the schedule. It'll keep the bond, the mental attitude, and the mental aspect of mood regulation to the brain for the happiness, and the support system, especially if you live by yourself. From there, you want to add in some vigorous activity. So that's increasing the heart rate to a certain extent so you can work some of these muscles. You can do that by a number of means, even contracting certain muscles just sitting in your chair. I wouldn't say as hard as you possibly can, but a decent amount to where you're getting the heart rate up, we're getting blood flow to the tissues. How we can get cardiovasculature work throughout the body, starting off either walks throughout the day and then maybe one day a week for 20 to 30 minutes trying to get your heart rate up. And that's via muscle contractions sitting in the chair, like I said, or going out for a walk, maybe try a jog, see how well your knees, joints, hips can go through with that. If you can't do that, either try elliptical or bike, or even just moving your arms up and down or in circles, pain-free movement. That'll also help to a certain extent, and then building up from there. So that's where I'd start. In terms of building and starting a routine, some of which is putting yourself in the right environment. So whether that's going to a class, having and surrounding yourself with people that are not going to bring stress into your life and that are here to support you and where you're at in your journey. From there, you can push other people, you can gather more of a community, you can push yourself and then grow and adapt. And I know we said this on a previous episode last week, is then you can put your identity of the person for whatever topic, whether that's I'm a dog walker, or I'm a cycler, or I'm a workout fiend, if we will. A huge one I would suggest for most people, try Tai Chi, especially if you're 65 and older. You're going to notice a huge improvement of how you function. Then it's also scheduling it out in your everyday life and making it a regular thing, because consistency, it all comes back to how consistent you are over a longer period of time. Those are a few aspects to where that can help you start, maintain, and continue on habits for longevity for exercise and workouts.
Perfect.
But,
so
yeah,
definitely getting into the what to do bare minimum. That's going to be obviously important right away for those who aren't moving right now. But is there a place where people should shoot for? And I know that could be kind of taken any way possible. Maybe not to get to an ultra marathon runner status, but what's a good solid goal that people can shoot for, not only for cardiovascular but obviously strength training too? Is there a good way that you feel people can shoot for to kind of get optimal results?
So for that, after you worked into getting yourself in the tissues and the cardiovascular, your heart, blood vessels, veins, arteries, as you get those accustomed to the new movements, from there you want to build up to 150 minutes a week of moderate sustained activity. And then you can add in 75 minutes of vigorous activity throughout the week. And that would be a goal for most people to go and base their schedules on a weekly basis. If you can more, beautiful, but you want to monitor how your body feels and not to move into pain, because then that's going to lead to breakdown of your body and certain structures, which then forces other chemicals to heal that injury and not for the overall function. So that would be a one that you want to get to. And then also just even add in strength training, you want to build in muscle mass, because also kind of like what Doc said is if you don't have the muscle mass, especially later in life, I know fall risks are going to be a huge factor, and more of that is for some of the fast twitch muscles. So if you're moving and if you hit a curb or you can't lift your leg up, maybe it's via something going on in the lower back hip. Do you have that quick reflex? Do you have that quick twitch to catch yourself? And if you don't, then you're going to tumble and then everything kind of goes from there. So it's that fast twitch that you have to build up, and that comes through strength training over a period of time.
Yeah, that's interesting too. I definitely knew the component of muscle mass, but even the specific fibers, absolutely, that's important. And I knew what you had mentioned before about fall risk is absolutely true. I think it is when someone who is at a certain age, I think it's over 65, who has a fall risk, I think their chance of mortality within 5 years is, I think it's 60 to 80% or something like that. But yeah, no, very good point. So yeah, I want to just touch on, as far as the fundamentals of a diet, what is a diet and how is that going to impact our life when it comes to a longevity standpoint. Diet by itself is just what you're consuming each day, right? But what a lot of people hear is, when they hear a diet, it's like, what did I change for a period of time to get a certain result? That's where most people are hearing diets. But diet alone is just what you're consuming day to day. And I think too many people try to switch their diet to get a certain result and then end up switching back to their habitable diet, right? And so too many times people are either going on a very what is restricted or very difficult diet because they weren't practicing an appropriate diet to begin with. And that's, again, we're all human and we get that, but what's most important is trying to sustain something over time is going to give you the results that you need. And so with diets, I always say this: if you're going to go on a diet, you're already setting yourself up to fail. Because most often than not, two things happen. One, you switch back to the typical diet after a certain period of time, and two, the weight you lost will come back on. Or you might even gain more after it. And so you don't necessarily need to switch your diet to a point of just drastic intensity. There are ways that you can still consume diets that are of moderation, and you still have the ability to engage into some cheating, splurging. There is absolutely ways to do that. And so the longevity diet, really, when you compare it across all cultures, isn't one specific diet. It's the same concept to the diet, which is caloric restriction. If you eat less, you will live longer. That is the longevity diet. It isn't what you eat, it isn't how you eat, it isn't anything other than to do of eating less allows you to live longer. And so they looked at that, obviously, with the blue zone and blue zone diets, which blue zone is just a area of the world where there is a high amount of centenarians, people living over 100 years old. And not only diet, they definitely did practice a lot of other beneficial things, including meditation, like you've talked about, having a lower amounts of stress. They had many community settings, or did a lot of things as a community. But as far as diet goes, they had a restricted caloric diet. Most of their diets came from whole foods, and there was, most of the protein that they consumed was either fish or high quality protein. So to say that you can't get by on life with a good source of protein, some whole foods, and just restricting calories, you're already going to see loss of weight if you're restricting calories. It doesn't mean that you also can't add in moderative fun things here and there, but restrictive calories is going to be the longevity diet. So that's just what I wanted to kind of hit on, sum up the focus on diets.
So going into inflammation. Now, inflammation often can perceive as something negative. However, inflammation is also good to protect us from injuries as well, which is a whole topic that we're going to get into in a later date. But Doc, for you, inflammation, and how does that impact longevity and how the body functions?
For sure. Inflammation by itself, what is it? Is it good? Is it bad? Can it be either? And absolutely it can be good and bad. So when it comes to inflammation, let's say you get a cut on your arm, you know that it's starting to puff around the cut, it's red, it maybe hurts, there's pain signals being sent. The inflammatory process is what's going to heal that. Now, too many times where we sustain an injury that didn't properly heal, such as torn ligaments or torn muscle or something that's a little more drastic, the body create an inflammatory component through the phases of healing. It maybe did a decent job, but it laid down matrix that was probably either weaker or just didn't properly heal. And the brain can pick that up. And so over time, you might have a weaker area, you might not have as much stability. And that can, again, when there's weakness, it can derive inappropriate movements in the body. It can jar tissue. It can create more damage, which then creates more inflammation. And that over time, when something has become chronically inflamed, you're going to have not only more pain, but just you're going to have less health in that tissue when there's a drastic inflammatory component to that area. So inflammation, we've heard it before, chronic inflammation especially, being able to go on longevity diets or just any diet itself, you even heard of anti-inflammatory diets as one of them, right? Well, it has nothing to do with a certain diet. It's just trying to reduce calories so that you can induce autophagy, so that you can induce healthier cells to create healing and limit the kind of foods that create a more pro-inflammatory response or just basically cause more reactive immune response into the body. It's not something super specific unless, of course, you have a heightened immune system that's different, but just in case of inflammation alone, sugar will do that. So when you talk anti-inflammatory diets, it's probably super similar to this diet versus that diet, and there really isn't anything specific about it other than you've limited a lot of the foods that a lot of diets do anyway, which is ultra-processed carbs and just a lot of those sugary foods anyway. So that's inflammation in a nutshell. And as far as longevity goes, when you have inflammation in the body, it's already going to cause poor cellular health, which again, over time, if it creates more cellular senescence or dead cells, we don't want that. That's something that we're going to try and get rid of anyway with fasting or other types of components that way. So
Absolutely. And
Yep.
there's one thing I want to add. When there's a lot of inflammation, like you said, there's a bunch of resources for tissues to heal up. Where there's lack of oxygen, there's disease. And if you can't get blood flow to that area is not going to function, and it's not going to get the waste products and filter that out throughout the body. So that's also where movement comes into play. That's where proper nutrition, water intake, it all comes together.
Very good
I want
point.
to add on. So now moving forward, mitochondrial function plays a factor for brown tissue stores.
for sure. And the reason we're talking about mitochondria now is because we're going to be prefacing mitochondria into talking about cold plunging, which is huge effects on brown adipose tissue, which is what Dr. Jace just mentioned. So with mitochondria, that might actually be the one thing that most people remember from their health class, is mitochondria is the powerhouse of the cell. But what does that mean? It means that they produce ATP, which is energy for the body. And so when you have poor mitochondrial health, you're not producing as much energy, and energy is what is going to drive recharge, regrowth processes in the body. So the term that Dr. Jace brought up was brown adipose tissue, and we have forever thought that brown adipose tissue was actually only in infants. And the reason why infants have brown adipose tissue is because it's heat producing. And so a lot of the ways that infants regulate their body temperature is with brown fat. Now, as we get older, we thought that adipose tissue gets turned into fat, white adipose tissue, or fat, basically. What we have found now is we still have brown adipose tissue in adult bodies, and it can still create a lot of metabolic regulation when we have proper stimulation of brown fat. And ways to do that, like we're going to talk about, cold plunging is one of them. We're going to want to continue to stimulate that because they are mitochondrial powerhouses. The brown fat has a high amount of mitochondria in them. And so when we're going to try to change metabolism, when we're going to try to change anything that we're requiring more energy into the body, healing, what have you, brown fat is what they're trying to research as a way to improve a lot of those cellular processes. So with mitochondria, we know as we age, our mitochondrial function decreases, just like anything. We've talked about that now how many times? And so the goal is to try to improve mitochondria health over time so that those kinds of processes can stay active and we can get the positive feedback. And a healthy mitochondria can improve in life. So that's mitochondria and how it can impact longevity. Of course, over time, when we have more energy and we have cellular regrowth, cellular recharge, and we have all the processes that need ATP over time, we're going to have more cell turnover. We're going to have healthier cells in general. Those are going to be where longevity is going to be impacted with a healthier mitochondria.
So with mitochondria, that also can be impacted via fasting as well.
Yes.
Help the health of the mitochondria, and does that depend on certain cells throughout the body or as a whole?
Yeah, so just like we had talked about with fasting and autophagy, when we fast, we actually have the ability to kill off dead cells and reproduce new cells, which means we're reproducing new mitochondria, new healthy mitochondria.
Yes.
So yeah, with fasting, there actually is a huge improvement in cellular turnover, and with a new cell comes a new mitochondria. So with the biogenesis of new mitochondria, we now have the ability to have a brand new, healthy, 100% battery mitochondria, which is able to then give a higher output of energy for your cells so that you can, again, live longer and live healthier.
So for mitochondria and how that can even be influenced via the cold and cold exposure, came across a stat, and I knew about this way back when, is parents put their babies, their children out in the snow in Switzerland for improved their immune function, but also how they grew and adapted. And this lasted for those infants for most part of the rest of their life. So I thought that was kind of funny, because a lot of people and parents want the kids to bundle up, but at the same time we want to stress certain genetics, stress different areas of mitochondrial function, just so we can improve the immune function of how our bodies regulate cold temperature. But Doc, cold exposure, how does that impact longevity?
For sure. So I'm sure if you are doing any social media at all, cold plunging has increased, especially within the last, I'd say maybe even a few years, couple years. And there's good reason for it. It's not just something that jacks you up once you get in cold water. There are studies out there that has shown improvement in a lot of parts of the body. Now, when it comes to cold immersion therapy, which is where you're getting into cold water, that is different than cryotherapy, which is where you're standing in a tank and incredibly cold air is being pushed up upon you. And so there's differences between the two, versus even swimming in a cold ocean or sea versus just standing in a cold temperature too. So there are many things that we still need to study the different effects on, but we do have enough information to at least get started on why someone would want to do cold immersion therapy or not. By far the greatest amount of research we have on cold immersion therapy comes with reducing what's called DOMS, which is delayed onset muscle soreness, which just means, and I'm sure you guys have noticed this too if you've worked out, let's say you hit a really heavy leg day, and the day after it's sore, but it's not that bad, but that next day you aren't able to get up the stairs, and it can be brutal. So what they found was cold plunging can actually delay that, or it can even prevent it from being as severe. So we know that that's crucial, which is why they've even been doing ice baths since the 70s and 80s, obviously, with athletes and sports. Like, that's not new, but we have enough research to know that it can help. When it comes to other things, we're starting to see much different research than we thought before when it comes to cold plunging. So what we're seeing is it can actually stimulate brown fat tissue, which again then in turn stimulates the mitochondria to improve metabolic rates and improving the heat thermic effect, all those kinds of things that upcharges your metabolism. But not only that, they're seeing changes with testosterone or other hormones. There is research to show that when you do certain temperature cold immersion, there is a huge release of certain neurotransmitters, norepinephrine, epinephrine, catecholamines, other things like that, which when that happens, you feel certain mood enhancing effects, clarity effects, maybe even just changes in mental focus and clarity. The other few things that they're seeing is immune system boost is definitely one of them, and we still are trying to understand the full effects of why that's helpful. A lot of the reasons I think people are hypothesizing is just being able to, again, stimulate brown fat, which stimulates metabolism, which of course then improves your ability to heal and what have you. But not only that, it releases what's called cold shock proteins, and cold shock proteins can do a few things. One, they help build tolerance to cold temperatures, but two, they're very helpful when there is stressors on the body. They are secreted to help build and repair after a stressor has been put into the body. So over time, those are the kinds of things that when you start to do cold immersion therapy, you're going to see a lot of these benefits, but it's going to take some time. You don't just see it with maybe 1 or 2 plunges. It's going to take a few times.
I came across a study, and this is where, if you guys haven't heard of Wim Hof, he's a individual who goes and hikes up mountains in just shorts, no t-shirt on. He actually did a study with a university in the Netherlands, Radboud University, and this was a study from Knox in 2014. They took 100 individuals that trained with Wim for a period of time. After 100 days, and the training include like going into Arctic waters of temperatures like negative 27 degrees Celsius. They played around the snow, then they hiked up a mountain of 1,500 meters tall, so they could build up the effects. From those individuals with the breathing, they then injected endotoxins, which is almost a form of E. coli, or it was induced to create an infection. And they found through the breathing work on how you can increase the energy within the cells through the breath, that is through hyperventilation, breathing, you can signal adrenaline, epinephrine to also fight the infection. They said they noticed an impact of pro-inflammatory mediators in terms of the inflammation of the body, where for some people decrease up to 50%, but then the anti-inflammatory measures to break down and fight that infection for some individuals were 200% higher.
Dang.
So just
cool.
from that, and it's a small sample size, it's from people that were trained for 100 days. Now, how that can be utilized throughout the general public is a huge factor, but that's where we still need more research. We still want to dive into certain capabilities, but there is possibilities for not only the immune function, fighting off infections. So
that's super cool, because a lot of the research that they've done are on Arctic sea swimmers, or people that either train in those kinds of temperatures or just are around those kind of temperatures anyway. And again, more research is definitely needed to really confidently hypothesize what cold immersion therapy can help you do. But these are just things that anecdotally over time we're hearing, and then more and more research will hopefully be built so that we can get a really good understanding of what dosage is going to equate to what effect. Because right now, from the research that I've read, we don't have that yet. There is no true dosage of temperature to time to frequency of what that all is going to then put an effect out. We have a good idea, but it's still a lot of research needs to be done so that we can confidently say, you need to sit in this temperature for this long and do it this many times to get this outcome. So again, use caution before you start plunging. Definitely contraindications to plunging is going to be different. We didn't even know this, but Doc and I were talking the other day about certain contraindications that we would recommend, and one of them is going to be Raynaud's, which is basically it's a condition where there's just a poor circulatory status in the body. Those who have Raynaud's will usually end up getting red, white, and or purple fingers in a certain chronological order, just because of the shunting of blood and the ability, the vascular status to reach those areas of the body. But along with Raynaud's usually comes with some other different things too. But so circulatory issues, we definitely would, if you have, recommend you talking to your physician. But even if you don't, this can be a pretty intense form of therapy for any type of thing you want to do. So just so you know, before you jump into this, make sure you exercise caution. Make sure you talk to the appropriate individuals, providers, so that we don't have any adverse effects from doing this. So Doc, I know you have done cold plunging before. I've done cold plunging. What have you seen as far as outcomes or benefits for yourself when doing it, and maybe the people that you do it with or around you?
For me, when I go into it, most days I do a mix of hot and cold showers together, almost every day. Showers are different than full water immersion from my point of view, but in terms of a flushing mechanism, going from heat to cold, or just ending the shower for the last 30 seconds in cold and getting through that shock is going to increase the dopamine levels. It's going to increase adrenaline to get you ready for the day. In fact, since I knew we were talking about cold water plunge, I jumped in the pool this morning. I think the pool is somewhere around 48 degrees right now, which is good. This is for myself. Anecdotal evidence is anytime we're getting from 37 degrees Fahrenheit to 50 degrees. I'm looking at a couple other case studies, and they haven't looked at other pro-inflammatory markers as much, but I've noticed a huge effect of when you're in that time frame and when you're in that temperature range, you notice that you'll only need to spend 3 to 5 minutes at a time to get to that effect. Once you have that effect, you can get out. So for me this morning, it was 3 minutes and I was good to go. But I've noticed a huge intake of starting my day off, the clarity, awareness, the energy for doing more, and makes it a lot easier, not only in the morning, but as the day progresses. So whether that's cold showers, whether that's full water immersion, for most people, unless you have a cardiovascular condition, which check with your provider like Doc said, I think would benefit significantly. It's just breaking down that barrier in your mind to go into the cold.
Yeah.
How about you,
For myself, when I was doing and still do cold plunges, when I first started though, is kind of what I wanted to start with. It was incredibly difficult, and what you'll notice too is maybe individuals who have been under a lot of stress or have just had a lot going on in their life, they get into that cold and their nervous system is really heightened at that point because of just the amount of stress they've been under. And you've probably noticed this too when you are really stressed. You maybe have a shorter fuse for your temper, and maybe you're irked a lot easier and you're more irritable, right?
Yes.
It's the same thing when you are jumping into that cold plunge. You're just overcome with this flush of a nervous system reaction, and you maybe can't even catch your breath. And so it takes some practice to be able to sit into that water for longer periods of time. But what I do know is after I was doing it for routinely for maybe a month, I was able to sit in pretty cold temperatures within the lower 40s for at least 4 to 6 minutes. And it didn't feel as much of a challenge. It's still absolutely cold no matter what you do. You get into that water, it's cold. Like there's no way around it. You think it's going to get cold or warmer, and it never does. It's still cold. But the kinds of effects that I've noticed for sure was, number one, my stress and or feeling of stress went away. It almost just cleaned it out, like cleared it out. Then again, my ability to go after the day and be met with more stressors was improved. I felt like I had like a shield around me, and I was able to do a lot more complex, difficult things all at once, and it wasn't getting to me. Along that, I did notice for sure ability to focus, my mental clarity, my cognitive benefits improved for sure. Mood was great. Just that kind of area of life definitely had an uptick or improvement. And then the last thing that I noticed too was my ability to regulate certain temperatures improved, which is crazy because I was in Arizona. I'm in Arizona at the time, which I was expecting it to be worse, but this was actually in the summer when I started, and I could face the hotter temperatures better.
Oh, yes.
So what's crazy is we talked about, improving tolerance to cold, but I think there might be some research coming out showing you'll just have a improvement of facing harsher climates or the more extremes, right? Extreme stress, extreme temperature, extreme anything. And it's crazy that cold allows that for heat, and who knows, vice versa. I'm not sure if there's any studies on heat extremes and how that changes the body either. But yeah, that's what I definitely noticed, and I do recommend cold plunging to anyone who wants to start it. I think it is a practice that every day is cost effective. One, cold water is pretty affordable. There's not much that you need to do different in your day to get it. If you have a cold bath or cold shower, that's going to be about 50 to 60 degrees for most people's cold water tap. So that's a great place to start. Andrew Huberman is another pretty viral guy that came out talking about cold plunging. He talks a lot about just the kinds of different things that you can get into. He recommends 11 minutes a week to kind of get started. That kind of gives you again, we talk about bare minimum of just getting the effects of it. So 11 minutes a week is how he kind of starts it out. I would recommend you start with the 50 to 60 degree, maybe not jump right into the 30, 40 degree. It is very, very cold. I would work your way down. The things that you're going to feel in that 50 to 60 degree, you can still feel with the colder temperature, it just might take longer. So you feel free to sit in that temperature maybe 5, 10, 20 minutes versus if you get into that cold temperature, like Dr. J said, you don't need to sit in it that long. You maybe only need to sit in it to 1 to 5 minutes to get those profound health effects. So starting out, I recommend definitely 50 to 60 degree temps, shoot for 11 minutes a week. And if you're going to do colder temperatures, you don't need to do it as long, maybe 3 to 5 minutes. And then, 3 times a week is probably a great place to get started. If you want to do it every day, absolutely. I want to get to a point where I do cold immersion every day. I just know that that's one thing I'm going to add into my routine within the next year in trying to get to that, at least, if not 3 times a week, but every day, because I'm sold on it.
Just even the effects that it has on the body, it has way more pros than cons for most people.
I agree. I do. I can absolutely agree with that.
Yeah, so we're going to end with what are things to avoid for longevity.
Right.
And with that, I guess I'll start off. Lack of sleep for most individuals is incredibly important because the majority of recovery comes during REM sleep or the deep sleep that you have. And if you don't sleep well, it's going to affect how your processes and functions cellularly, and it will have a huge delay on performance, impact cognitive function, thinking, memory, relationships. So sleep is definitely a huge aspect that, honestly, if you're not sleeping well, if you're not feeling well rested in the morning, it's going to break down your body over time.
Yeah, and we maybe didn't do a decent enough job talking about that today, but there's a reason why, because we want to dive into sleep way more in depthly in the future. So sleep probably should have been at least at the forefront of this conversation because of just how drastic its effects can have on your body. They say that if the pharmaceutical companies could patent one thing to have such a profound impact on the body, it'd be sleep.
Yes.
If they could turn sleep into a drug, it would be the #1 most sold drug in the market. With its ability to impact so many different things in life. So yeah, lack of sleep. We know how much better we feel with better sleep. And those of you out there who are fighting to sleep better, those who have insomnia, those kinds of things, I know that the struggle is real because of just what lack of sleep can do to all day, everyday function. So yeah, for sure. Lack of sleep. The next one for me is going to be smoking. I don't even know why.
Or tobacco use.
Yeah, I mean, I understand nicotine is one of the hardest things to get rid of in life. I've been around those who have tried to get rid of it in their life. It's incredibly difficult, and I really do wish they would figure out a way to kill off these tobacco companies still, but it is what it is. If you smoke, I'm sure this is the 9,000th time you've been told smoking is bad for you, so there's no real other way to say it other than it's going to drastically reduce your life. And I think with a study I just read the other day, along with other studies I've read in the past, one, you're going to get a higher risk of cancer. We know that one. Two, it affects pretty much every other cellular process in your body and or process as a human. Three, you will have detrimental effects in the future once you quit, and they don't return. The benefit of quitting smoking, which may now deter you from quitting, but I don't want you to, you won't get the effects of quitting smoking back for maybe 10, 20 to 30 years. There's effects that they've studied that you regain in 10 years, 20, and 30 years. And so I understand that it might take some time to regain what you've lost from smoking, but no matter what, you have lost already from smoking. I don't know if this was even something that's true or not, but I've heard every cigarette you smoke takes away so many hours or days of your life. I can't remember if that's even true or not, but I would agree with it. I would argue that that's true because it is full of very, very many toxic chemicals, and I don't think there's one benefit
No.
of smoking.
Other than the sensation that you find yourself in, habitual wise.
Yeah, for sure.
And I remember even in schools, like especially elementary school, you see a healthy heart and a smoker's heart, and you can see the differences.
Yep.
There's so much tar on the smoker's heart, and then not only in the heart, but how the vascular system and how it can clog up the runways of blood in, blood out. Now, I think the next one for me is going to be sedentary lifestyle. And I know we touched on this previously. If you're not getting blood flow to other areas of the body and waste products back, like I said, it's going to lead to breakdown, degradation of how you function throughout your body. If you find yourself sitting for a period of time and or injured, that's also where you have to rebuild the habits of getting and working to rehab the injury, but also for everything past that. So,
you know, what's crazy is Dr. T was talking about how there is more exponential benefits that is given to someone who does nothing and changes their habits to doing 10 minutes of walking a day than those who are already doing something and then adding more exercise onto that. There is like a drastic difference in the change that a person can get from just adding 10 minutes of exercise on a day. That's it. And so when I heard that, I'm like, wow. I mean, for those who are already working out, keep it up, great. But for those of you who are not, there is a huge benefit to adding even at least 10 minutes a day to exercising and just moving your body. To think that you aren't getting anything from it, you absolutely are. I thought that was interesting.
And then to linchpin, once you have that habit already built in of walking 10 minutes a day, then you can add in maybe some strength training.
Yes.
Right after that, and then there you go, you can build up.
Yeah.
But
dumbbell movements, body weight, very simple stuff.
Absolutely.
100 push-ups a day is what I still do. I'm gonna finish it up with alcohol, which I've spoken before in the past, something that I've given up. Wasn't easy. For those of you that are struggling with it, please seek help. I did, and I needed to because I couldn't do it by myself. So if you know of someone who needs that, there are definitely services out there. But yeah, alcohol. We talk a lot about just what alcohol does. Dr. Amen is a pretty well-known brain professional out of California, and he just talks about how when you consume alcohol, it lowers your motor neuron output by 50%. Meaning, let's say your nerves travel at 200 miles an hour, they now travel at 100 miles an hour. And so we talk about the breakdown of cellular communication, right, today. If we're not having appropriate, quick cellular communication, we're already going to be functioning less and not having improvement in life. So it can dehydrate you. It can damage certain organs. It can also cause you to do other things that are not habit healthy, which again, those of you that know, when you have been drinking, you usually want to eat higher carbohydrate and or more fatty food because of just certain cravings that you can get from drinking it. So the question is, how much or what can I get away with? And I don't even want to get into that because I am so strongly opinionated on it. What I do want to argue, and I'm going to push this point, is the glass of wine a day, which I know a lot of people have heard so many times. And I'm going to argue it with this to say that the reason why the wine a day concept was brought up was because there was a component in wine called resveratrol. And resveratrol is in a certain dose is very cardioprotective. It's also has a lot of protective effects on the brain and other parts of the body. Now, what you don't know is they have now enough research to show what a therapeutic dose of resveratrol is. And what that means is you need to consume enough of it to get an effect.
Yes.
And unfortunately, one glass of wine isn't getting you your therapeutic dose. And in fact, I'm actually going to throw out how much wine you need to get a therapeutic dose. It's about 312 glasses of wine.
seen that.
So
Sorry.
that is where the problem becomes, where you feel that you hear this information and it's something that you are going to take because you like it, and I know that it's something that you enjoy with your daily routine. But if you're drinking wine because you think it's healthy for your heart, I'm sorry to say that it is not. Now, there might be some other effects you're getting from drinking that wine, which is reducing stress. That's not to say that reducing stress isn't important. I just would encourage you to find better outlets to reduce stress. Being dependent on a certain vice to reduce stress is a slippery slope. And you want to talk about lynch pinning habits up, we can still talk about lynch pinning habits down, where one can come upon another. So with that, I'm going to leave you with alcohol absolutely will reduce your health span and lifespan. Drinking 1 glass a day of wine does not protect your heart. And if you're going to use alcohol to reduce your stress, then I would just recommend you find a different outlet.
I don't even need to add anything onto that because we're on the same page there.
Yep.
That was everything that we have today for you. This was everything longevity-wise. So please leave comments, questions below. This is the Functional Code Podcast. We are here to serve. We hope you guys have a great rest of your day.
Yes, we appreciate you listening. We hope that everything that we put out is helpful, and we just want to know your feedback. So please comment, let us know. And thank you guys so much, Doc. We'll see you guys next time.
Thanks for joining us on the Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.